Earlier on in the week, we learned about the scientific basis behind radiotherapy treatments and how our machines are accurately able to deliver cancer-destroying beams of radiation. Today, I'm here with Ane Appelt, an academic physicist at Leeds University who is based at St James's Hospital. So Ane, tell us a bit about your job role.
So I'm a medical physicist and I trained as a clinical physicist, and I still spent about a third of my time doing clinical work here at St James's, working in the radiotherapy department, in the treatment planning team, on ensuring that we're delivering the best possible treatments every day for our patients. But for 2/3 of my time, I'm in an academic role, so I'm doing research as a university academic fellow funded by Yorkshire Cancer Research. And what I'm really focusing on in my research is how we can improve our radiotherapy treatments going forward for future patients. And specifically, we're looking at how we can use mathematical models and outcome models to optimize our treatments. So right now, we are delivering individual treatments for all our patients. As we heard about earlier in the week, we are doing a lot of imaging so that we, in a 3D model, can optimize our treatment taking the individual patient's anatomy into account. But we want to be able to optimize treatments taking even more things into account. Things like the specific tumor characteristics for that patient, their gender, their age, their comorbidities, and so on. So if we can do that, if we can develop models that relate the dose we deliver to the patients, their characteristics, to the probability that we can get tumor control, but also the risk of side effects from the treatment, then we can deliver completely individualized treatment.
Wow. Using computer models to develop individual treatments sounds like extremely challenging but worthwhile research. And what projects are you currently working on?
So one of the projects I'm working on, and a project that we're hoping will really take off in 2018, is a project on anal cancer. So anal cancer is something I'm very interested in, and it's a cancer that we can treat really well with radiotherapy. But it's also a relatively rare cancer. So in order to be able to get enough patient data from our routine practice to develop the models I talked about, we need to collaborate between multiple centers. And right now we've set up a collaboration with centers in 3 countries where we are trying to access data from all 3 centers to be able to develop outcome models, so both for tumor control and toxicity. So if that's successful, we can use these models going forward to deliver even better radiotherapy for our anal cancer patients.
It's really great to hear that your research is going to improve the quality of life of our patients here at Leeds Cancer Centre. So tell us about your goals for 2018.
Now, in addition to developing models and doing research based on data from previously treated patients, we are also running prospective trials, so trials where we are testing out new treatment approaches for our cancer patients. And one of the other patient groups that I'm working with is rectal cancer patients. So also patients with cancer in the lower part of their gastrointestinal system. And for these patients, the standard treatment would usually be that we give them a large operation to remove the tumor. But especially if you're a bit elderly or a bit frail, getting such an operation can be a really big deal, and it can actually be quite risky. So we're trying to develop new ways of treating these cancer, and specifically we're looking at whether we can treat them with radiotherapy or chemoradiotherapy alone rather than surgery. So we've been lucky enough to get a grant from Yorkshire Cancer Research to run a prospective trial where we're trying to find out what is the best radiotherapy treatment if you want to do non-surgical management of rectal cancer. So we're going to randomize patients between 2 different radiation doses in order to try and figure out what is the right radiation dose to use to treat rectal cancer without surgery. And we're setting up this trial in 2018, and hopefully we'll be ready to enroll patients by the end of the year. So that's what I'm going to be spending a lot of my time on.
Great work, Ane, and really, really congratulations on your grant. Best of luck for your research in 2018, and thanks for talking with us.
Thanks.